Welcome to Rumination, the podcast that offers practical solutions to the challenges in our industry. Hi, this is Chris Gwynn, and today I'm talking with Dr. Greg Penner, University of Saskatchewan. Greg is the U of S, University of Saskatchewan Centennial Enhancement Chair in Ruminant Nutritional Physiology. And today we're going to dig down a little deeper into the nutrition of receiving cattle with a focus on ruminal and luminal acidosis. Dr. Penner, thanks for joining us on Rumination.
Always a pleasure to be here, Chris.
Hey, Greg, recently you participated in the annual Jeffo Beef Academy, and your presentation talked a lot about acidosis risk and management practices and nutritional practices to minimize those risks and the subsequent negative consequences of acidosis. Could you summarize for the audience some of the key points of that presentation?
Yeah, I guess I really enjoy talking about ruminal acidosis, and obviously that's the core focus of my research program. And, we see subtle differences between beef cattle and dairy cattle. And in this case, when we're focusing on feedlot cattle, we're feeding diets that are high in starch, high in fermentable carbohydrates total because of that processed starch that's going in, or the processed cereal grains, and inherently a fairly low fiber content. So we have a situation where there's a lot of fermentable material going in the rumen. The bugs, the rumen bacteria respond very prominently to all of that available carbohydrate, and they rapidly produce acids. And where it differs from dairy cattle, in most cases with dairy cattle, we just see a very high VFA load. But actually in feedlot cattle, we can see that lactic acid start to accumulate. And lactic acid has the potential to drop pH further than the volatile fatty acids. So under normal situations, we see pH drop after feeding, and then as that fermentable carbohydrate is used and the cattle start absorbing those acids and buffering the rumen, we see rumen pH stabilize. When we get into issues, it's really because while that fermentation process is ongoing, we can have challenges to the gut lining within the gastrointestinal tract. And so we often talk about permeability or barrier function, and that's really just the ability for cattle to maintain absorption of nutrients while preventing compounds from crossing that gut that we don't want to cross the gut, like bacteria or like antigens. And so really I highlighted how this happens and the negative consequences on the gut and what this means from a whole animal perspective. So that was really the classical model. What we found in more recent research is highlighting some of the primary risk factors, and I think these don't get enough attention under conventional feedlot management. We've often thought that diet adaptation or transition phase is the major problem, and that's not what the research is telling us. With the best management practices that feedlot operators are currently implementing, we don't see that severe rumen acidosis occurring during diet adaptation anymore, not like we did at least in the 80s. But what we do see is health events that cause reductions in feed intake, and those reductions in feed intake do a great job priming the animal's susceptibility to rumen acidosis.
Okay. Can you expand a bit more on that?
Yeah, so a good example here, and there's great work out of the University of Calgary and out of Texas showing that cattle with respiratory disease drop feed intake, and they may drop feed intake by more than 80%. So eating about 20% of their expected intake for 5 to 7 days. Now you think about that for cattle in a feedlot pen, might already be on their finishing diet, so a pretty highly fermentable diet. They go through a transient reduction in feed intake, probably pulled, brought back to their home pen, and as they start to recover, they rebuild intake, and because of that low feed intake, their absorptive capacity in the rumen is dropped. The microbial load in the rumen is dropped, but can recover very fast, right? Their turnover times or their growth phase is very rapid, and those cattle just aren't equipped to deal with a rapid increase in acid production. And so we think under those situations, that's the primary driver that increases risk for rumen acidosis under feedlot conditions. Other causes, heat stress will drop feed intake, variable feeding patterns. We think, it's not confirmed, but we think remixing events. So if we're going into terminal sorts and using a terminal implant and regrouping cattle, that restabilization of social structure probably causes transient feed intake responses, and we think might increase risk for rumen acidosis.
So it's really these secondary stressors or secondary health events that are creating the risk for acidosis versus vice versa, where acidosis is creating secondary health events?
Well, we think it's probably both ways. So first of all, I've been emphasizing, respiratory disease or lameness causing a reduction in feed intake, and that definitely increases risk for rumen acidosis. But if you look at other secondary causes, so if we have rumen acidosis, we think risk for liver abscesses goes up. We think subsequent risk for lameness will go up, and that would be primarily lameness driven by laminitis. Certainly if we have established liver abscesses, those liver abscesses can rupture and influence or impact the lung. So it's really a cycle here. I think there's management and health events that influence feed intake patterns, and really those feed intake patterns have a high risk for inducing rumen acidosis under highly fermentable diets. And then once that acidotic challenge is provided, then we have the classical model where rumen acidosis can lead to lameness or liver abscesses.
So there was some also discussion about the immune system activation and energetic costs, and wondering if you could expand a bit more on that.
Yeah, so when we have low pH in the rumen, and that's primarily been our focus, we know we also have pH drop, particularly in the hindgut of cattle. So we could call it hindgut acidosis, or maybe the better term is just luminal acidosis to represent what's going on through most of the gastrointestinal tract. The challenge with that is when pathogens, so bacteria, and we've probably all heard about bacteria involved in liver abscesses like Fusobacterium, but Salmonella can also cross the gut. Salmonella has been looked at in terms of its importance for food safety and contamination in meat. But as those bacteria are detected by the gut will induce a pro-inflammatory response, so a local pro-inflammatory response. And if those bacteria enter systemic or blood flow, then we can see another inflammatory response, partially mediated by circulating immune cells, but also by the liver. That has an enormous energy cost, and that's been looked at a lot in the dairy world. Lance Baumgart is leading a lot of that research. We know also on the dairy world that infusion of LPS as one example of an antigen has an enormous amino acid cost. So if we extrapolate this data to growing and finishing cattle, these growing cattle are depositing an enormous amount of protein on a daily basis. Finishing cattle are depositing protein and an enormous amount of fat on a daily basis. Both of these processes take substantial energy, and if we're diverting energy to critical functions like the immune system, we're probably explaining why we have decreased feed conversion coupled with lower energy intake that probably happens when those cattle are sick. And I think this is largely well explained with severe liver abscesses. When you look at performance data of cattle that have severe liver abscesses, so these would be the A+ livers, we know we're giving up carcass, right? And we're probably giving up carcass because they are battling or mounting an immune response, and that immune response is diverting some of the energy and protein that would otherwise be available for tissue growth.
So really your point about the protein hits home, because we often talk about the energy cost of immune function and forget the amino acid cost, but of course that's critical in these rapidly growing animals.
Absolutely. And it's a huge gap right now. There's only one study that I can find in cattle that looks at irreversible amino acid use or loss in cattle when facing an immune challenge. So, Energy is always talked about, but we can't forget that, the energy and protein are linked, first of all, and then from a whole animal homeostatic mechanism, the loss of protein represents more than just the amino acids. It's also a substantial loss of energy.
Makes me wondering whether our colleagues on the monogastric on the swine side maybe have looked at this a little more clearly and the amino acid needs of sick animals, etc.
Yeah, swine and poultry. There's actually a pretty active group in the poultry world, Clausing, that has done a ton of work looking at energy and amino acid requirements under an immune response.
There's always something else to investigate, isn't there, Greg?
Thankfully, yeah. Hopefully, we investigate things that are going to be practically relevant and economically relevant to the end users. But yeah, there's always something to look at, and we just need to make sure we're identifying those items that have the greatest long-term benefit.
So, as we wind up, take-home messages for the audience today on managing the nutrition of those receiving cattle?
Yeah, I think take-home messages, we've learned a lot in 30 years, right? And I think the management practices we've implemented have largely corrected for the acidotic events that we probably used to see. That's really shifted where we probably see the rumen acidosis events now. So late finishing still remains a problem, and we think there's also a problem related to disease incidence. Again, early work supports that, but it's not well defined. I think where we could go, we can always quantify the energy and amino acid requirements, but at the end of the day, I still wonder, what do we do with these animals that are sick? And there's still going to be animals that are sick, and so are there ways that we can either reduce the risk of them getting sick? And there's lots of intervention strategies to do that already. We still have a respiratory disease problem. And so are there ways that we can actually accelerate how fast those cattle recover after getting sick so that we can minimize the risk for ruminal acidosis or other secondary health outcomes? So I think it's an exciting field. I'm happy to be participating in it and love talking about it, Chris.
Well, we can hear your passion and your knowledge. So thank you very much for sharing those points with us today here on Rumination. So, Greg, and just to wind it up, thank you very much for your time. Today. Visit with us and share your knowledge and your experience.
Always a pleasure.
And I surely want to thank our audience for listening in to us today. So you won't miss our next episode of Jeffo Rumination Podcast. You can find us at jeffo.ca, Apple and Google Podcasts, as well as Spotify. This podcast was brought to you by Jeffo Nutrition, precision nutrition for a growing world.